This happened 6 months ago. Still can't sleep right. I'm 32, ICU nurse at Desert Valley Regional in Phoenix. Been doing this 8 years, seen a lot of people die. Part of the job in critical care, you accept it. But what happened that weekend? Those 11 deaths. That wasn't supposed to happen. That was murder disguised as cost savings. Let me tell you about it. Desert Valley Regional is a 400-bed hospital. We're level 2 trauma, handles serious cases. ICU has 24 beds, always full or close to it. Phoenix metro area, lots of accidents, lots of sick people. I work night shift, 7 p.m. to 7 a.m. Usually there's 8 nurses on nights for those 24 beds. That's a 3-to-1 ratio, 3 patients per nurse. Industry standard for ICU is 2-to-1. We're already stretched. But it works. We manage. Nobody dies from lack of attention. Our unit is tight, good team. Mix of experienced nurses and newer ones. We watch out for each other, cover breaks, help with codes. ICU director is this guy Marcus. He's 58, been a nurse forever. He fights for us, gets us equipment, advocates for staffing. Good boss, actually cares about patient safety. Then last summer, hospital gets a new CEO. Woman named Stephanie. She's 45, MBA from some fancy school. 0 clinical background, never been a nurse or doctor. Came up through hospital administration, CFO roles. Hired through this Women in Healthcare Leadership program. Big press release about breaking glass ceilings. Her first town hall, she's talking about financial performance. This hospital operates at 4% margin. Industry average is 7%. We need to optimize, eliminate waste, improve efficiency. I'm sitting there thinking, here we go. Every new CEO says this stuff. Usually means cuts somewhere. First few months, Stephanie's looking at everything. Supply costs, contract negotiations, vendor relationships. Fine, that's normal CEO stuff. Then she starts looking at staffing. Brings in consultants, they're analyzing ratios. How many nurses per patient, how many techs, how many support staff. October, Marcus gets called to a meeting. Comes back looking stressed. Pulls the night shift together. CEO wants to reduce ICU nursing staff. Claims we're overstaffed compared to national benchmarks. One of the older nurses, woman named Linda, she's 56. She asks, what's she proposing? Marcus, cutting night shift from 8 nurses to 4. Room goes silent. That would put us at 6-to-1 ratio. 6 ICU patients per nurse. That's insane. That's dangerous. I speak up. That's below safe staffing standards. Marcus, I know, I told her that. She says other hospitals operate at those ratios. Linda, which hospitals? Marcus, she wouldn't say, just industry data. Another nurse, guy named James, he's 34. Did you explain what could happen? Marcus, I told her patients would die. She said I was being dramatic. We spend the next hour arguing about this. Marcus promises to fight it, bring data, push back. Says he'll escalate to the medical staff, get doctors involved. We go back to work, but everyone's worried. November, Marcus is having meetings with Stephanie. Brings patient safety data, staffing studies, everything. She's not budging. Keeps saying, we need to align with industry standards. Marcus brings in the chief medical officer. Dr. Patterson, he's 62, old school physician. He backs Marcus up. This is dangerous. Stephanie apparently told him, I won't be lectured by old guard. Healthcare needs modern leadership, not outdated thinking. December, Stephanie announces the cuts at board meeting. Effective February 1st, ICU night staffing reduced to 4 nurses. This brings us in line with peer institutions. We'll save $840,000 annually. Marcus is furious, asks to address the board. Makes his case, 6-to-1 ratio is unsafe. Points to studies, patient safety standards. Board members ask Stephanie about the risk. She says, every hospital manages risk. Our current staffing is gold-plated. We're asking nurses to work, not be overpaid. One board member, woman named Carol, she's 67, asks, what if something goes wrong? Stephanie, we have protocols, backup systems. This is about trusting our staff to be efficient. Board approves it, 8-3 vote. The 3 who voted no were the only ones with clinical backgrounds. January, we're scrambling. 4 nurses quit immediately, won't work under those conditions. Marcus is trying to hire, but word gets out. No experienced ICU nurse wants a 6-1 assignment. It's career suicide, license risk. If something happens, you're liable. Can't give proper care to 6 critical patients. We end up with 2 new grads filling the spots. Nice kids, just graduated but inexperienced. They have no idea what they're walking into. I try to warn them, this is not normal. ICU should be 2-1, maybe 3-1 max. 6-1 is dangerous. One of them, girl named Amy, she's 24. I need the job, I'll make it work. I feel bad for her, she doesn't know. February 1st, Friday night. New staffing goes into effect. 7 p.m., I clock in, check the assignment board. 4 nurses for 24 patients. I've got beds 1-6. Amy's got 7-12. James has 13-18. New guy named Kevin has 19-24. My 6 patients, 3 on vents, 2 fresh post-op, 1 septic. These are sick people, need constant monitoring. Normally I'd have 3 patients max, could watch them closely. Now I've got 6 spread across the whole unit. Can't be everywhere at once. First hour, I'm running. Check vitals on bed 1. Alarm goes off on bed 4. Rush over there, vent pressure issue, fix it. Need to give meds to bed 3. Bed 6 is calling for pain medication. I'm triaging, doing what I can. But I can see things slipping already. Normally I'd chart in real time. Now I'm charting late. Normally I'd catch small changes early. Now I'm reactive. By 10 p.m., I'm behind on everything. Haven't done my hourly rounding properly. Haven't checked all the 4 sites. Haven't repositioned patients who need it. I radio Marcus. He's the charge nurse tonight. This isn't working. I can't keep up. Marcus, I know, just do your best. Document everything. I'm documenting too. He's building a case, showing it's unsafe. But that doesn't help me tonight. Midnight, I'm exhausted already. Only 4 hours in, 8 more to go. My patient in bed 4 starts desaturating. Oxygen levels dropping, vent alarms screaming. I run over. He needs suctioning. Airway is compromised. Takes me 15 minutes to stabilize him. While I'm doing that, bed 2 pulls out her 4. Blood everywhere. She's confused, pulling at tubes. I can't leave bed 4 yet. He's not stable. I call for help. Amy comes over. She's overwhelmed too. I can see it in her face. Can you handle bed 2? Amy, I've got my own patient's coding. We're drowning. 1 a.m. James loses a patient. Bed 16, elderly guy, septic shock. Pressure drops, heart stops. James calls the code. We all respond. Except we can't all respond because we got our own patients. I run over to help, leave my 6 patients unmonitored. We work on bed 16 for 30 minutes. Can't get him back, call it. Time of death, 1:34 a.m. James is shaken. I didn't see it coming. Was checking on bed 14, didn't notice his pressure tanking. Marcus documents it. Death potentially preventable with adequate staffing. But there's no time to process. We go back to our assignments. 6 patients each getting more unstable. 2 a.m. Amy's patient in bed 9 arrests. She calls for help. We respond again. Another code, another patient we can't save. Young woman, 31, post-surgical complication. Pulmonary embolism, went too long without intervention. Amy's crying. I checked her an hour ago. She was fine. Marcus, hour ago is too long in ICU. Should be checking every 15 minutes. Amy, I can't check 12 patients every 15 minutes. She's right, it's impossible. 2 deaths in 3 hours. Normally we might lose 1 patient in a week. This is falling apart. 3 a.m. Kevin's patient in bed 22 deteriorates. Respiratory failure. Needs intubation. Respiratory therapist is in another code. We're waiting, patient struggling. By the time we intubate, he's been hypoxic too long. Brain damage, even if he survives. Kevin's brand new. Didn't recognize how fast it was going south. 4 a.m. I'm running on adrenaline. 3 patients lost, multiple close calls. My own patients are sliding. I can feel it. Bed 5, post-op patient, bleeding internally. Didn't catch it early because I haven't been able to assess properly. Pressure's dropping. Abdomen is distending. Call the surgeon. Emergency or they rush her to surgery, but she's critical. If I'd had 3 patients instead of 6, would have caught the bleed an hour earlier. Better chance of survival. 5 Uhr morgens. Saturday morning. Sun's coming up. Day shift arrives at 6:30. We give report, tell them what happened. 3 deaths, multiple crises, chaos all night. Day shift has 8 nurses back to 3 to 1. They're shocked. 3 patients died. Marcus, inadequate staffing. I'm reporting this. I go home, can't sleep. Keep seeing those patients, their faces. The alarms I couldn't respond to fast enough. The monitoring I couldn't do properly. Saturday evening, I'm back for another night shift. Same 4 nurses, same 6 to 1 ratio. We're all traumatized from the night before. Marcus tried to get emergency staffing approved. Stephanie refused. One difficult night doesn't change policy. Staff needs to adapt to new ratios. 7 p.m. Saturday, we get news. Mass casualty incident on I-10. Semi-truck hit 4 cars. 8 critical patients incoming. We're already full, 24 beds occupied. Now they're bringing 8 more. Marcus is on the phone with hospital administration. We can't take them. We're at capacity. Administrator, we're level 2 trauma. We have to take them. Marcus, then we need more nurses. Administrator, weekend, can't get agency staff on short notice. Marcus, this is going to be a disaster. 8 p.m., first casualties arrive. They start doubling up beds, putting patients in hallways. My assignment goes from 6 patients to 9. 9 critical patients, 1 nurse. This is medically impossible. Amy's crying before we even start. James is pale, looks sick. Kevin's asking if he should just quit now. Marcus is documenting everything. Taking photos, writing incident reports in real time. He knows what's about to happen. 8:30 p.m., the chaos begins. Bed 3, my elderly vent patient, pressure drops. Bed 7, new trauma patient, internal bleeding. Bed 11, septic shock, needs vasopressors. I'm running, literally sprinting between beds. Can't keep track, can't monitor properly. Alarms are going off everywhere. Nobody can respond fast enough. 9 p.m., we lose bed 11. Septic patient, pressure bottomed out. Couldn't get the meds in time. Too many other patients. Code called, worked 15 minutes. Couldn't get her back. 9:45 p.m., bed 7 crashes. Trauma patient bled out. Surgeon was in another, or couldn't get there fast enough. By the time we got him to surgery, too much blood loss. 10:30 p.m., bed 14, stroke patient, James's assignment. Clot in brain, needed immediate intervention. James didn't catch the signs fast enough. Too many patients, too much happening. Patient has massive stroke, brain herniation. Family pulls life support 2 days later. Counted as death from this weekend. 11 p.m., I lose another one. Bed 4, my vent patient from the night before. He was stable, survived Friday night. Tonight, I couldn't monitor him properly. Vent got disconnected somehow. I didn't notice. Went 10 minutes without oxygen. Cardiac arrest, couldn't revive him. I'm standing there over his body. This man survived. Last night, died tonight because I was with a different patient. Couldn't be in 9 places at once. Midnight, Amy loses 2 patients in 20 minutes. Both new trauma patients from the accident. She's screaming for help. Nobody can come. We're all drowning in our own assignments. Both patient code, both die. Amy collapses after the second one. Panic attack, can't breathe, can't function. We have to pull her off the floor. Now we're down to 3 nurses for 30-plus patients. 1 a.m., another death, bed 19, Kevin's patient. Post-op complication, didn't get caught in time. 2 a.m. Sunday morning, I call Marcus over. We need to shut down, this is mass casualty. Marcus, I've been calling administration for hours. Nobody's answering, CEO won't respond. Me, people are dying, we need help now. Marcus makes an executive decision. I'm calling in everyone I can reach. Screw the budget, screw the CEO. He starts calling off-duty nurses, begging them to come in. Some do, bless them. By 3 a.m. we've got 3 more nurses. 7 total now, still understaffed but better. Ratio drops to about 4 to 1. We stabilize somewhat, but the damage is done. 3 a.m. to 6 a.m. we lose 3 more patients. All preventable with proper staffing. All deaths that didn't need to happen. 6:30 a.m. Sunday, day shift arrives. We give report, everyone's in shock. 8 deaths overnight Saturday, plus the 3 from Friday night. 11 total deaths in one weekend. Worst disaster in hospital history. I clock out, drive home in a daze. Get home, shower, can't wash off the feeling. Those 11 people. Someone's mom, dad, sister, brother. Dead because we didn't have enough nurses. Dead because a CEO wanted to save $840,000. Sunday afternoon, I can't sleep. Keep replaying the weekend. Every alarm I couldn't respond to. Every patient I couldn't monitor properly. Every death I might have prevented. My phone rings, it's Marcus. State Health Department is here. Someone reported the deaths. They're investigating. I ask who reported it. Marcus, I did this morning. Sent them everything. All my documentation, photos, reports, the whole weekend. Monday, I'm called in to give a statement. State investigators very serious. Walk me through both nights. How many patients? What happened? Why? I tell them everything. The impossible assignments. The missed interventions. The preventable deaths. They interview all of us day and night shift. Interview Marcus. Review all his documentation. Request staffing records, board meeting minutes. Everything about Stephanie's decision. Tuesday, news breaks. Local news gets wind of it. 11 deaths at Desert Valley Regional under investigation. Hospital goes into crisis mode. Stephanie issues a statement. Deeply saddened by tragic losses. Full cooperation with investigation. Doesn't mention the staffing cuts. Doesn't take responsibility. Families of the 11 patients. Start asking questions. Why did their loved ones die? What happened that weekend? Hospitals trying to keep it quiet. But word gets out. Nurses are talking. We can't stay silent. I give an interview to local news. Explain the staffing situation. 3 patients per nurse became 6. Then 9 during the mass casualty. Physically impossible to provide safe care. Reporter asks. Who made the decision to cut staff? Me. Hospital CEO, Stephanie. Against medical staff recommendations. We warned this would happen. Within 48 hours, it's national news. Hospital CEO's cost-cutting leads to mass casualty event. Stephanie's trying to defend herself. Does an interview claiming she was misled. Medical staff didn't adequately communicate the risks. That's a lie. Marcus has documentation proving otherwise. Emails, meeting minutes, everything. He provided it all to investigators. Week later, State Health Department releases preliminary findings. Staffing levels fell below safe standards. Multiple deaths directly attributed to inadequate nursing coverage. Hospitals' cost-cutting measures created unsafe conditions. Recommend criminal investigation. Arizona Attorney General opens case. Criminally negligent homicide, 11 counts. Stephanie's arrested 2 weeks later. Perp walk, news cameras everywhere. She's crying, saying this is a witch hunt. Female CEO being scapegoated. This is gender discrimination. Her lawyers pushing that angle hard. But prosecutors aren't buying it. This isn't about gender, it's about 11 dead patients. Hospital's board fires her immediately. Puts Marcus in as interim CEO. First thing he does, restore full ICU staffing. Back to 8 nurses on nights, even added 9th. But it's too late for those 11 people. Trial starts 4 months later. Prosecution presents Marcus's documentation. All the warnings he gave. All the meetings where he explained the risks. Board minutes showing he advocated against the cuts. Stephanie's response. I won't be lectured by old guard. Prosecution presents testimony from all of us nurses. We each describe that weekend. The impossible assignments. The deaths we couldn't prevent. The patients we couldn't monitor. Medical experts testify. 6-to-1 ratio in ICU is dangerous. 9. to 1 is catastrophic. Industry standard is 2 to 1. Hospital violated basic safety standards. Families testify, this part breaks me. Wife who lost her husband in bed 16. Parents who lost their daughter in bed 9. Son who lost his father in bed 4. My patient. All preventable deaths. All because of a budget decision. Stephanie's defense tries to argue she relied on expert advice. Consultants told her these ratios were acceptable. Prosecution brings in the consultants. They admit they recommended caution. Never said 6 to 1 was safe. Recommended phased approach with monitoring. Stephanie ignored that, went straight to cuts. Defense tries the gender angle. Female executive facing male-dominated medical staff. They resisted. Her leadership. Prosecution shows this is nonsense. Half the medical staff is female. They all oppose the cuts too. This wasn't about gender. This was about ignoring safety for profit. Jury deliberates for 6 hours. Comes back with verdict. Guilty on 11 counts of criminally negligent homicide. Stephanie breaks down crying. Sentencing 2 weeks later. Judge gives her 8 years, eligible for parole in 5. You were warned repeatedly this was dangerous. You had documentation, expert testimony, begging from staff. You prioritized budget over patient safety. 11 people died as a direct result. 8 years represents the severity of your negligence. Hospital settles with families. $40 million total, divided among the 11. Insurance covers most of it, but hospital's reputation is destroyed. Desert Valley Regional almost closes. New CEO, new board, complete overhaul. Takes 2 years to rebuild trust. Today, 6 months after the trial. I'm still at Desert Valley, still ICU. Marcus is still CEO, doing a good job. We're properly staffed now, sometimes overstaffed. Nobody wants to risk anything like that again. Amy quit nursing, couldn't handle it. Last I heard, she's doing something in tech. Don't blame her, she was traumatized. James is still here, we work together sometimes. We don't talk about that weekend much. Don't need to, we both remember. Kevin left, went to a different hospital. Needed a fresh start somewhere without the memories. Hospital put up a memorial in the lobby. 11 names, 11 people who died. Includes the 3 from Friday and 8 from Saturday. I walk past it every shift. Remember their faces. Bed 4, the elderly man on the vent. Bed 9, the young woman post-surgery. All of them. Sometimes family members come to visit the memorial. I've talked to a few of them. Apologized, even though it wasn't my fault. They understand, they know we tried. They know who was responsible. Stephanie's in prison, serving her time. Tried to appeal, denied. Probably serving 5 years, then parole. She'll be out by the time she's 50. 11 people don't get to be 50 or any age. They're gone because she wanted to save money. $840,000 annually. That's $77,000 per death, if you do the math. That's what she valued their lives at. Hospital CEO cut ICU nurses to save money. 11 patients died that weekend, and I was there for all of it, holding their hands when we lost them, running between beds, trying to save them, failing because one person decided profit mattered more than people. I still have nightmares.